Seniors, your muscles are disappearing without this vitamin in your diet. Helen never used to think twice about standing up from her favorite chair, but now, at 74, it felt like her legs didn't respond the way they used to. Grocery bags seemed heavier. Climbing stairs left her winded. Even holding her arms up long enough to brush her hair sometimes brought a deep ache. She hadn't changed much in her daily habits, so what was changing inside her? If you're over 60 and noticing that your body feels weaker, slower, or more tired with everyday tasks, it's not your imagination, and it's not just getting older. There's a silent shift that happens in the body as we age, and it starts with something small, your muscles. In today's video, we're uncovering the critical vitamin that helps protect muscle strength and prevent the slow, frustrating decline that so many seniors face. It's a nutrient that often goes unnoticed until the symptoms become too loud to ignore. If you're missing it, your muscles could be disappearing faster than they should. Before we go further, tell us where you're watching from. We read every single comment. And don't forget to subscribe for more senior-friendly health advice that actually makes sense and respects your stage of life. Now let's talk about what's happening beneath the surface. Why muscle loss happens after 60. There's a name for the age-related muscle loss many seniors experience: sarcopenia. It starts as early as your 40s, but accelerates around age 60 and beyond. Simply put, sarcopenia means your body loses muscle mass and strength faster than it can build it back up. And unlike the kind of muscle loss you might expect from skipping exercise for a few days, sarcopenia happens quietly, even if you're staying fairly active. Muscles are constantly being broken down and rebuilt, but as we age, the balance starts to shift. Hormonal changes, slower protein synthesis, reduced appetite, and changes in how nutrients are absorbed all contribute. The result? A slow weakening of the muscles in your arms, legs, core, and even the muscles that help with breathing and posture. What's worse is that muscle loss affects more than just movement. It affects balance, independence, and even survival. Seniors with sarcopenia are more likely to fall, less likely to recover quickly, and often lose confidence in their mobility. That's why identifying and addressing this issue early is so important. And here's where nutrition becomes key, because while you can't stop aging, you can give your muscles the tools they need to stay strong. And that starts with a specific vitamin. The vitamin that helps prevent muscle loss, vitamin D. Yes, vitamin D. It's often thought of as the bone health vitamin, but more and more research shows its critical role in maintaining muscle strength, preventing falls, and supporting coordination, especially in older adults. Vitamin D helps the body absorb calcium and phosphorus, which are essential not just for bones, but also for healthy muscle contractions. It also plays a role in activating the nerves that tell your muscles to move. Without enough vitamin D, these signals become weaker. Muscles don't respond as quickly. Reaction time slows. And worst of all, your body starts to lose the protective strength it needs to stay upright and mobile. But here's the problem. Vitamin D deficiency is incredibly common in seniors. Why? There are a few reasons. First, the skin makes vitamin D when exposed to sunlight, but older skin is less efficient at producing it. Many seniors also spend less time outdoors or use sunblock to protect their skin, which blocks vitamin D production. Add in long winters, mobility challenges, or time spent in assisted living, and it's easy to see how sunlight drops off. Second, very few foods contain enough vitamin D naturally, and even those that do might not be eaten regularly by older adults. The result? A slow, steady drop in vitamin D levels that often goes unnoticed until the symptoms creep in. Symptoms of low vitamin D in seniors. Low vitamin D doesn't show up as a rash or fever. It shows up in quiet, frustrating ways. You might feel more tired than usual, even after a good night's sleep. You might feel unsteady when getting up or turning around. Your legs might feel weaker, your arms less coordinated, or your grip a little shakier. These aren't random aches. They're signs that your muscles aren't getting the nutrients they need to stay strong. Some seniors with low vitamin D also report frequent muscle cramps, especially in the legs, back or shoulder pain that isn't tied to any injury, reduced walking speed, more difficulty recovering after exertion, and in some cases, symptoms of depression or low mood. This is because vitamin D supports not just muscles, but also mood, immune health, and brain function. It's a central part of your body's operating system, and when it's missing, things just don't work as smoothly. Worse, the longer a deficiency goes uncorrected, the more vulnerable your body becomes to falls, fractures, and prolonged hospital recovery. That's why many senior care doctors now recommend checking vitamin D levels as part of routine wellness checks, especially if there are signs of declining strength or balance. Just to lock that in, vitamin D isn't just a bone vitamin. It's a powerful protector of muscle strength, coordination, and confidence. And if you're low, your muscles will feel it, often before you even know why. Food sources and absorption factors. So, where can you get vitamin D from your diet? Unfortunately, the list is short, but it's not impossible. Fatty fish like salmon, mackerel, and sardines are among the best natural sources. A 3-ounce serving of salmon, for example, can provide more than half of your daily vitamin D needs. But not everyone enjoys fish, and not everyone eats it regularly. Other sources include egg yolks, beef liver, and fortified foods like milk, orange juice, and breakfast cereals. Many dairy products and plant-based milks now include added vitamin D, but the levels vary, and they're often not enough on their own. There's also the question of absorption. As we age, the body becomes less efficient at pulling vitamin D from food. And if you have any digestive conditions, like Crohn's, celiac disease, or a history of gastric bypass surgery, absorption becomes even harder. Certain medications, especially those for cholesterol, acid reflux, or seizures, can also reduce how much vitamin D your body can use. To improve absorption, it helps to eat vitamin D-rich foods with a source of healthy fat, since it's a fat-soluble vitamin. For example, having eggs with avocado or fish with olive oil and veggies can make a real difference in how much your body actually retains. For seniors at risk of deficiency, many doctors recommend a vitamin D supplement, especially during the fall and winter months when sun exposure is low. These are usually in the form of vitamin D3, which is more effective at raising blood levels than D2. But it's important to choose the right dose. Too much vitamin D can cause problems too, so it's always best to check with your healthcare provider before starting a new supplement. Some seniors may need a blood test to determine their current vitamin D level, especially if they've had a fall, have low bone density, or are noticing muscle weakness. That way, any correction plan is targeted, not guesswork. While many foods contain small amounts of vitamin D, the body often struggles to extract enough of it through diet alone, especially after age 60. That's why pairing food sources with the right conditions for absorption is key to making sure this critical nutrient actually gets where it needs to go. For starters, fatty fish remains one of the best options. Salmon, mackerel, trout, and sardines all carry high levels of naturally occurring vitamin D. But to help the body absorb it, seniors should eat these with a source of healthy fat like olive oil, avocado, or even a small handful of nuts. These fats support the digestion and uptake of vitamin D in the small intestine, where absorption takes place. Egg yolks are another helpful food. One large egg yolk has a modest amount of vitamin D, but when paired with other nutrient-dense foods like sautéed spinach or mushrooms, it contributes to the overall intake in a meaningful way. For seniors who can tolerate them, fortified dairy products like milk and yogurt are also helpful. Just be cautious about added sugars in flavored varieties. Mushrooms, especially those exposed to sunlight, are a unique plant-based source. While not as potent as fish or supplements, they do provide a small boost, particularly for those with vegetarian or lighter diets. To get the most benefit, the key is consistency. Eating vitamin D-rich foods once a week isn't enough to keep levels steady. The body stores some vitamin D in fat cells, but regular intake is still essential, especially in colder months or when sun exposure is limited. Try including a vitamin D-rich food and combine it with healthy fats for optimal absorption. Now let's talk about what can interfere with this process, because even if you're eating the right foods, certain factors can block the benefits. What interferes with vitamin D absorption in seniors? As we age, the body's ability to digest and process nutrients slows down. The skin makes less vitamin D from sun exposure, and the digestive tract becomes less efficient at absorbing what we eat. These changes make it easier to fall into deficiency without realizing it. One major factor is low stomach acid. Seniors often produce less hydrochloric acid, which is essential for breaking down foods and freeing up fat-soluble vitamins like D. Without enough acid, vitamin D may pass through the digestive system without being absorbed at all. Digestive conditions also play a role. If you've ever been diagnosed with celiac disease, Crohn's disease, or irritable bowel syndrome, your body may struggle to absorb fat-soluble vitamins consistently. Even if you're managing symptoms well, nutrient absorption can still be reduced. Chronic conditions like kidney disease or liver issues can also affect how vitamin D is converted and used by the body. These organs help activate vitamin D so it can do its job, and when they aren't working properly, the vitamin stays inactive and ineffective. Lifestyle habits matter too. Smoking, excess alcohol, and long-term inflammation in the body can reduce how much vitamin D you retain. Even low-grade inflammation, common in arthritis or metabolic issues, can interfere with how your cells respond to the vitamin, even if you're technically getting enough of it through diet or supplements. Medications that reduce vitamin D levels. Several common prescriptions also interfere with vitamin D, often without warning labels. If you're taking any of the following, it's worth checking with your doctor about your levels. Corticosteroids, like prednisone, often used for inflammation or autoimmune issues. These drugs reduce calcium absorption and impact vitamin D metabolism. Cholesterol-lowering drugs, especially bile acid sequestrants. These can bind to fat-soluble vitamins and carry them out of the body before they're absorbed. Antacids or acid blockers. Medications like omeprazole or ranitidine reduce stomach acid, which affects fat-soluble vitamin breakdown. Certain anti-seizure medications. These can accelerate vitamin D breakdown in the liver, leading to lower active levels. Diuretics, used for high blood pressure or heart failure. These can influence calcium balance, which is closely tied to vitamin D function. If you're on any of these medications, especially more than one, getting your vitamin D levels tested becomes even more important. It's a simple blood test, and many primary care doctors include it as part of a standard senior wellness check. What to eat and how often. To maintain healthy vitamin D levels through diet, the goal is variety and frequency. Relying on just one food source, like eggs or milk, won't cut it, especially if your absorption is already compromised. Here's a realistic weekly rhythm for vitamin D support. 2 to 3 servings of fatty fish per week, like salmon or trout. Daily eggs, if tolerated, especially at breakfast. Fortified dairy or plant-based milk once or twice a day. Vitamin D mushrooms, cooked and paired with a healthy fat. Add olive oil, avocados, or nuts to meals for better absorption. And choose warm, cooked meals in cooler months to support overall digestion. If you don't enjoy fish, try canned sardines or salmon mixed into soft spreads or salads. These are easier to prepare and often more affordable than fresh fillets. Safe supplement tips for seniors. If you're still falling short, and many seniors are, supplementation is a safe and often necessary step. The most commonly recommended form is vitamin D3, which is the most bioavailable, easy for the body to use. For most seniors, a daily dose of 800 to 2000 IU is considered safe and effective. Some people may need more, depending on their blood levels, but it's best to start low and increase under medical supervision. Taking more than 4,000 IU per day for long periods is not recommended unless specifically instructed by a healthcare provider. It's best to take your supplement with food, preferably a meal that contains some fat. Morning or lunchtime tends to work well for most people since it can slightly increase energy and improve mood. Also, look for supplements that include vitamin K2. This helps the body use calcium properly, directing it into the bones and away from the arteries, where it doesn't belong. You don't need a separate pill. Just choose a D3 plus K2 combination if possible. If swallowing pills is difficult, liquid drops, chewables, or gummies are just as effective. These are widely available and often easier on the stomach. Let's go over this part again. Getting enough vitamin D means more than just sunshine or the occasional glass of milk. Seniors need to eat vitamin D-rich foods daily, support absorption with healthy fats, and consider a well-balanced supplement if needed, especially when taking medications or dealing with slower digestion. Have you noticed signs of weakness, slower movement, or poor balance, but didn't know why? It's easy to blame aging, and many people do, but often it's not just time passing, it's something your body is missing. And when it comes to muscle strength, coordination, and confidence in daily movement, vitamin D may be the missing link. The good news? You're not powerless. These changes don't require a complete lifestyle overhaul. You're not expected to hit the gym or start a high-protein diet overnight. All you need is the right knowledge and a few simple, nourishing choices that fit your life. What signs have you noticed in your muscles lately? Do you feel like it's getting harder to lift, stand, or stay steady? Drop your experience in the comments. We read every single one. Your story might help someone else realize what they've been missing too. And if you found this helpful, hit subscribe so you never miss another senior-focused health tip. We're here to help you stay informed, strong, and independent without confusion or overwhelm. You deserve to feel good in your body. Let's make sure it has what it needs.